afternoon, everybody. This is John Mangiaratti, the Acton Town Manager. You're tuning in to Java with John, which is a monthly program that we run over at the Acton Senior Center. We've been doing it for about a year. We get together and I have a great opportunity to talk to many of our residents and give them some updates. And then we take questions and answers. Since of this COVID epidemic, we've been doing it virtually, and we have another episode here for you today. I'm pleased to announce that we have some special guests joining us, and so we'll do the normal updates. But before we get into that, I'm going to have one of our featured guests get started right away. I'm very pleased to welcome State Senator Jamie Eldridge from Acton, and he's here with some updates from Beacon Hill. Senator Eldridge.
Great. Thank you, John. Thank you so much for having me on and doing this monthly job with John. I really appreciate you doing it. And I know there are other people, other town officials here on this virtual call. So just the Beacon Hill update. And, I, like most of my colleagues, am mostly working from home, but sometimes going into the State House as we're looking to pass legislation. And this week, and I have a great update for today, is that Governor Baker just signed what is essentially the second municipal relief bill for towns and cities that would allow towns to delay their town meetings, as well as to provide more flexible borrowing authority to make sure that the town budget continues to support all the critical services, as well as allowing for more remote meetings, including possibly for town meetings. And it's just really critical that, as town officials, whether elected or those, working at town hall or the community center, is that we want to make sure to provide all the information to you to sort of show you that, not only what people are doing, but that the democratic process continues at the local level. So this legislation will allow for that. There was also a provision that was really advocated from a lot of social service professionals around making sure that if anyone in any town in Massachusetts, any town or city, if you are unable to pay your property taxes due to, losing your job related to the COVID-19 pandemic, or if you're unfortunate enough to have COVID-19, that the town or city cannot shut off services. So, water, sewer, trash service. Quite honestly don't think any towns and cities would do that, but we just wanted to make sure at the state level that people, especially from vulnerable populations, especially the elderly and disabled community, had that protection. So Governor Baker has signed that bill into law. And I also today did a call earlier with some of our Acton and Boxborough food relief stakeholders, from the United Way to Meals on Wheels to the Acton Food Pantry. And, my general sense is that people have been very generous with donations, and, an entity like the Food Pantry or the Community Supper are finding ways to deliver food to people through drop-off service to maintain our social distancing. And really what my role is with that is to make sure that if sort of human services or social service agencies are seeing an increase in need or gaps, I fully support, passing a state sort of supplemental budget. And that could be more money for emergency food assistance. It could be for rental assistance. It could be for different ways to provide support to our nonprofits and towns and cities that are doing great work to protect, all of our residents. So I certainly am looking for feedback on if there's any gaps there. And, I've been reaching out and been in regular contact with John Mangiaratti. So John, I appreciate our close interaction. One partnership that we worked on that was very successful this past week is I had found out about a medical supply company that towns and cities could order supplies from and I really want to express my appreciation to John for putting it in order and then helping make that delivery possible last Sunday. So to provide the N95 surgical masks and other supplies to our first responders. So, really as a legislator, just finding a lot of different ways to connect people, but ultimately really want to seek, guidance from my constituents, from town officials on what we can be doing better at the state level. And just a quick example of one that's pending is the House of Representatives passed an eviction and mortgage foreclosure moratorium bill last night. I'm hoping the Senate will take it up very soon, and that would just prohibit, during the coronavirus pandemic, any evictions or any foreclosures on homeowners or renters through the course of the pandemic. So I've heard a little bit from constituents about their concerns about paying rent. So we're hoping that addresses some of those concerns. And again, happy to take suggestions. And I know this is one of the vehicles to do it. So John, thanks very much for having me on, and I'll be listening.
Thank you, Senator. We really appreciate all of your support, and thanks to you and your colleagues for the work that that led to the governor signing that new legislation today. That's really going to help us out. I look forward to talking to the Board of Selectmen on Tuesday about the information that you just provided, and it's really going to help us as we navigate this crisis. So as one question, actually, I don't expect that you will be able to stay on the whole time when we take questions at the end, but how is it going for your work in the Senate, working virtually? Are you doing a lot of that, or how's that going?
Yeah, that's a great question. I think a lot of people either don't know what the legislature is doing or how we're doing it. But basically, especially on the Senate side, we've had working groups and a weekly call with the Senate president to get updates on legislation. And then at the State House, we have at least 2, sometimes 3, what are called informal sessions, where a bill can pass so long as no legislator objects. And so what you saw this week, and I went in twice to see the process at the State House and the Senate chamber, is that the municipalities bill passed the Senate, went to the House, had some changes there, went back to the Senate, and the bill went back and forth. And because no legislator objected, we were able to come to an agreement last night and then put the bill on the governor's desk for him to sign today. So I am going in once in a while, but for the most part, we're passing bills through an informal session. But we want to make sure to keep those checks and balances on all legislation. And then my staff, we're all working, everybody's working from their homes. So, the phone number at the State House forwards to a phone for my legislative aide. We're answering questions on unemployment, around being whether or not an employee is an essential employee, whether a business is an essential service, as well as some of the questions about people, losing their jobs and not having enough money for rent or needing access to food assistance. But no, the legislature is fully functioning, but it is a little bit more of a challenge to do it virtually.
Thank you. That's very interesting to hear how you're handling it in Boston. We're having similar challenges and implementing similar measures here in Acton. So that's really helpful to hear. I wanted to go next to our public health nurse, the director of Acton Nursing, Heather York. She's doing a great job of tracking the COVID-19 issue here, and she has some updates on that matter. Heather?
Morning, John. Thank you. So just a couple updates on the public health side related to Acton specifically. We are having an increase in the positive cases within town. There will be an update later today on the website with the total number of cases that come through today as added to the 5 positives that we have now. So that will come out this afternoon as we do some disease tracking. Our nurses and myself are doing a lot of contact and disease surveillance with contact cases also. So it is a pretty lengthy process, and as time goes by, we have a plan in place to implement other staff to assist with those calls and that tracing, as well as some volunteers from the MRC. And, you know, we're always looking for people to help when the time comes. The Board of Health members had a meeting last night, and a couple of those folks offered to assist also. So we're very appreciative that people are reaching out to do that, because we do feel in the days to come that it will increase. My update really is to talk about continuing to stay at home by the governor and the Department of Public Health's guidance. It is imperative that people really are staying at home as much as possible to reduce the spread and lessen that curve and have it get to the point where it starts to come down. As I'm sure you're all seeing on the news, the next 2 weeks are going to be concerning. As more tests are done and more cases are identified, the numbers will continue to go up. So our expectation is that we will also have an increase in number in Acton, unfortunately. But one of the biggest things people can do is staying at home and doing social distancing, staying 6 feet apart, not congregating in groups. You know, when you're outside doing activities that may take you out for exercise with your children, you know, you should stay in your own family unit. You shouldn't intermingle with other people. If you can obviously have conversations, but stay 6 feet apart. That's the most important thing. Going to the supermarket or the pharmacy, again, some of those vendors now are limiting the amount of people coming into the buildings, which I think is a positive move. You know, a week ago, there were so many people on my shopping trip that it was a little difficult to stay away. And unfortunately, not everybody had been taking it very seriously, so people were, you know, getting extremely close. Now there's markers on the floor to keep people 6 feet apart while they're in line. And again, so I know one of the places in Acton that's limiting folks going into a certain, I believe under 10, including the employees, is Trader Joe's, which is great. I think that's a great move for them. You know, so seniors, if you can get out to the markets and the pharmacies during the senior hours in the morning, best bet. A better choice would be if you have someone who can shop for you and who can drop things off, because as the seniors are the most at risk in the community, if you can have that ability to have people assist you and drop things off to your house, that would be great. I know the senior center, Sharon Mercurio, has been working with some volunteers who are looking to do that, and I'm sure Sharon can fill you in more through the senior center. So that's just great. It's very important for all of you to stay safe. And then, you know, again, continue hand washing, continue cleaning anything that's frequently touched. So important right now. Cleaning hard surfaces, doorknobs, light switches, cell phones. I think my most concerning thing I saw this weekend at the supermarket myself was that there were people who had masks and gloves on at the supermarket, but they were holding their cell phones in their hands and putting it up against their face to talk. You know, that's definitely concerning, because you may have gloves on your hands, but you're contaminating everything else that you're touching. So if you can keep that cell phone away and not touch it until you leave and disinfect your hands if you've been out, that's my tip for today.
Thank you. That's a good tip. Thank you very much. You mentioned pharmacies and grocery stores. I think I also want to mention that many of our restaurants are open and offering takeout and even delivery services. So we're doing our best to try to help them accommodate or adapt to this new style of business. And we do post daily updates to actonrestaurantweek.com for any folks, any restaurants that are offering takeout services, just to make sure that people know that it's available. But thank you, Heather. Actually, one other service announcement. We're live on YouTube, YouTube Live on ActonTV's channel. We're also live broadcasting on WAEM, Acton's local FM radio, 94.9. So I'm obligated to mention that every once in a while. So I just did. The other thing is the Board of Selectmen moved the town election, which was supposed to be March 31st. It's been moved to June 2nd to align with the special election to fill Representative Benson's seat in the House for the Middlesex seat. So people are encouraged to to vote by mail, and you can find information about that on the town clerk's website. You can fill out an application and send it in, and they'll send you a ballot to actually mail in. So you don't have to vote in person for that election. So go to the town clerk's website for more information. Another thing that we've been trying to do is there's a group called the Medical Reserve Corps, and our folks in our health department help oversee and coordinate that. So I know earlier this week we put out information on our website about recruiting volunteers for the Medical Reserve Corps, but not everybody knows what that is. So we asked Evan Carloni, our senior health inspector, who helps with that effort, to come and explain a little bit about what the MRC is. So Evan, could you let us know what is the MRC?
Thank you, John. Yes. So earlier this week, when we put out a call on the website for volunteers, the outcome has been great. We've had a lot of people come forward and volunteer and want to fill out an application to volunteer their time to help out during this crisis. So that's great to see. We do have a solid core of MRC volunteers, but anytime that we can add help, add professionals, both medical and non-medical volunteers, we'll take all the help that we can get. So to briefly explain what an MRC is, or Medical Reserve Corps, it is a group of both medical and non-medical volunteers that come together for local communities or on a regional or statewide basis during times of need. Really the purpose is to reduce vulnerability, to build resilience, and to promote public health around these communities. So MRCs can be called upon for many different events. It could be a public health emergency like we're in now with the COVID-19. It could be an event such as a hurricane, earthquake, tsunami, flooding, or just a local event like our household hazardous waste days. So locally, we have called upon our MRC for the H1N1. We did an emergency dispensing site at our highway department, and we needed volunteers for that because that type of event it requires a lot of hands on deck. And as a health department and with the nursing service, we can do quite a bit, but we really need that extra help and extra hands, and both medical and non-medical to help the nurses and to help us with the logistics. So again, we've gotten a great response, and we encourage anybody else who is interested to reach out to us at the Acton Health Division. We can be emailed at health@actonma.gov, and we can supply an application. We can give more information as to what we do locally, and we have a great onboarding video, which our region, we're a part of Region 4A in Massachusetts. I believe there's 7 preparedness regions. They've come up with a great onboarding video, which goes into great detail about how MRCs came about, how they really originated from 9/11, and how there were hundreds of thousands of people that came out of the woodworks who wanted to help, because we live in a nation full of very generous people who want to help, but this help needs to be organized, and volunteers need to be organized, and we need to go through the process of seeing where these people can help, so that we can guide that help in the best way possible. Again, if people want to reach out to the Acton Health Division, health@actonma.gov.
Evan, great job. Is there a phone number people can call?
Yes, yep. They can call our office number, which is 978-929-6632.
Great job. Thanks, Evan. That's very helpful information. And good luck with recruiting efforts.
Thank you.
As the Senator mentioned and Heather mentioned and Evan mentioned, one of the populations that we're very concerned with right now is our senior population. So as we always do, we invited our Council on Aging Director, Sharon Mercurio, to tell us a little bit about the outreach we're doing and some of the work we're doing to help our seniors, and information about any other resources that are out there for that group. Sharon.
Hi, thanks. Just wanted to remind people that we are here for you. The Council on Aging, we may be working remotely, but we're answering phones, we're answering emails. So if anybody has questions, comments, concerns, need assistance with whatever, please reach out to us because we're here to help you. Our phone number is 978-929-6652. We will probably be returning a call from a remote number, so it will not be a familiar number, or it may be a blocked number. So just keep that in mind. We are still running Meals on Wheels to our vulnerable population through Minuteman Senior Services. They're also still providing some grab-and-go meals for folks. So if you're interested in that, you can give us a call. We're also encouraging to take advantage of the other food resources available in town. So Acton Boxborough High School has bagged lunches for any resident in town, Monday through Friday. They just ask that you call ahead to order a meal, and that's 1-866-896-3599. And just a reminder that this coming Friday is Good Friday, so they'll be doubling up on meals on Thursday and not providing one on Friday. Open Table also has meals available for folks. We also at the Senior Center have some frozen meals from Open Table. We've been developing a nice partnership with them. So if you or you know someone that would just like to have some spare meals in their freezer, please give us a call. We sent out our newsletter this week, which looked very different. It's more of a resource newsletter, letting folks know about these programs that are available. Also, there's a lot of virtual learning out there. So if you are somebody that's tech savvy, there's a lot to do. ActonTV has been a great partner too. We've been working with them to get our exercise instructors teaching so you can have a familiar face and do your workout in the privacy of your own home. So Monday through Friday from 9 to 11, there's exercise classes with Terry, Yvonne, Mary. And then in the afternoon at 2, yoga with Patsy and line dancing with Carrie. And I believe we're starting 9 o'clock Saturdays with Terry as well. And they'll be taping some more at home just to keep you up to date with things. Our newsletter on the website, actoncoa.com, there's a newsletter tab that's being updated daily, weekly, with just different resources available to you, different programs that you may be interested in. And again, if you have any ideas for things, email us and we can include those. What we're seeing now is really a need for connection. People are really feeling isolated. I think the first week we were all in shock. The second week we're like, okay, we can do this. But now heading into the third, I think we're seeing more anxiety, more isolation. So reach out to each other. You're not the only one that's feeling that way. So pick up the phone, call somebody that maybe you used to do a puzzle with or have coffee with. Make those connections. It's really important. And if you're feeling lonely, so is everybody else. So you could be doing somebody a favor by reaching out as well. I have an update from Detective Mike Araglio, who shares space here with us. Just some concerns about the stimulus checks that will be going out. They're expected to go out the week of April 13th. If you did your taxes and included direct deposit, If not, it'll be in a few weeks from then. He just really wanted me to share caution about any phone calls, letters, emails, texts, anything, promising you that they can get your money to you sooner. That's not true. Nobody's going to be asking your banking information. So really just keep on your toes. You've done a great job so far. I think Mike's really drummed it into your head that you have to be careful of people taking advantage of you, but they're seeing this countrywide. So just beware and call if you have a question. Thanks.
Great. Thanks. Great job as always, Sharon. And we look forward to hearing you close out our session with a poem. Look forward to seeing what you have for us this week. So now is a portion of the program that we've set aside for any questions that you have from the public. The way we're doing questions today is if you're watching on YouTube Live, there's a chat function there where you could type in the question and then we'll get it on our screen and we can read it aloud. We do have a few that have come in already, so I can get us started here. This one looks like it's going to be for Heather. Have our first responders been tested, and have our nursing homes been tested for the virus?
So as of now, I'm not aware of any first responders who have been tested. The testing is specifically for anyone that is symptomatic, and I have not heard of anyone on the first responder team that is symptomatic where testing needed to be done. The second question
about nursing homes.
Nursing homes. So the nursing homes work under the Department of Public Health. That's where their license is from. So any positive cases that could be in that facility are typically followed by the Mass Department of Public Health. I know there was news about the mobile testing unit that is going to try to start going around to the local nursing homes and rehab facilities. I have not heard when Acton will be getting that done or if they will be doing testing on anyone who is not symptomatic. So that information will probably be coming out sooner than later. I know they're pretty tied up with a couple of places in the state that had some issues this week.
Okay, great, thank you. So here's another question that I know the answer to, but I think it's important for you to have the opportunity to answer it so that people understand. So this is one that I've heard many times in the last few weeks is, if you're telling us that there are positive cases, why can't you tell us where they are and who they are?
Sure. So any positive cases or any other contact information of someone who's been in contact with a positive case and is on quarantine, I am not allowed to give that information out related to privacy issues. So I can't give out the address, the patient's name, the location in town. If there was someone within our assisted living facility, I can't give that information out either. So it's just a privacy issue.
Okay, great. Thank you. Let's see, what else do we have coming in on the lines here? Are you recommending, here's a good one. Are you recommending that everybody wear face masks?
Sure. So as of now, the DPH guidance is no. They're not recommending that face masks need to be used anywhere except a healthcare setting that you may go, where they'll have you put a mask on based on you being, probably symptomatic at that point where you're coughing or sneezing. They will ask you to put a mask on. There was some hinting that maybe that will change as days go by, and the recommendation would be for people to wear masks. But again, it's changing so fast, and the guidance is coming out and being updated on a daily basis.
Okay, thank you. That's helpful. Here's a question. Hey, Sharon, is there any thought on creating a phone buddy program for seniors who may be feeling isolated, to allow people to maybe check in on each other in a coordinated way?
Sure, and we've got that going. So we reached out to our participants that were coming to the Student Center and asked folks how they were doing, if they wanted somebody to check in with them. So we do have that up and running. We have some folks that want daily calls, some that have just requested weekly calls. So if you or you know somebody that would like to be receiving a phone call, please give us a call and we'll set you up with a volunteer.
Okay. Oh, here's a question for Evan. Evan, is there a call for specific action of the MRC right now, or are you just recruiting for potential future needs?
Currently, we're just recruiting. I think that so far the workload that we're seeing on a townwide basis has fallen into the scope of staff being able to handle it. Working with the health director Sharon and of course Heather, this of course can change in a hurry. So right now, just recruiting. We have let our current MRC members know that they should be on standby because of the situation and how rapidly it could change. But a time like this, when people are willing to come out and be a part of this membership, in the Medical Reserve Corps, we'll take everybody we can get, because once we get beyond this, we never know when the next crisis will be, and having those people, on board and, cleared to volunteer is important. So right now, just recruiting, but that could change 5 minutes from now, or a few days, or a few weeks.
Okay, thank you very much. Here's a question here. Someone wants to know, is the transfer station still open? Yes, the transfer station is still open. Up until now, we've been operating at the normal schedule that we've always operated. However, we are in the process of trying to identify some modifications to the schedule, probably increase the number of hours that are available as one of the goals. And the second goal, having a dedicated time for seniors. We're trying to target that for 7 to 8 in the morning. And we're hoping to make an announcement about that before the weekend to have new changes go into effect next week. But I guess the message is that the transfer station hours will be changing, but they will be likely increasing. So good news on that. Another thing on that is that because of what we're trying to do and keep people separated, we're not letting people do as much business at the transfer station as you used to. You used to be able to go in there and bring money and buy a sticker or do several different things like that. We're trying to limit those transactions on a hand-in transaction basis. So we urge your patience and encourage you to do it online or through the phone or through the mail, so to allow us to keep our employees working there from having to directly interact with people as we're trying to limit that as much as possible. Evan, I think you had a question.
Yeah, I just wanted to add something on that last question. So locally, we're doing okay right now, but people who want to volunteer, they can volunteer just locally throughout Region 4A, which is made up of 33 towns and communities surrounding us, or they can also volunteer statewide or throughout New England. So just because we're doing okay right now, if folks want to volunteer and help out regionally or statewide, they can do that as well. And we encourage them to reach out to us. We can set them up for that avenue.
Okay, thank you. So this is Java with John with our special guests. We're on 94.9 WAEM. It looks like we have another question here. This one's for Senator Eldridge. It's what work is going on with voting reform?
Mm-hmm. Yeah, great question, because just mentioning earlier about just trying to sort of make sure that the wheels of democracy continue, whether it's a local level by boards of selectmen or Board of Health or different local boards, but also the legislature and legislative elections. And so, first of all, the first municipal elections reform bill we passed, which allowed for town elections to be delayed because of the COVID-19 pandemic, We also delayed the 4 special elections. So there are 2 Senate special elections and 2 House special elections, including the 37th Middlesex District, which includes precincts 3, 4, and 5 of Acton, former Representative Benson's seat. So, so those elections were delayed, but obviously we're in a period of time when, you know, we're really not sure when it's going to be safe for people to sort of congregate and be close to one another. And so, you know, how do we make sure that people are still able to vote while also, you know, not going outside of our homes? So one of the reforms in that municipal elections bill that happened last week was allowing expressly voting by mail, and also for no excuse absentee ballots for the town elections and for the special elections coming up. And so what that means is, for example, the special election, if you live in precincts 3, 4, or 5, and you want to vote in that election, you can now request through an online link a request to have a ballot mailed to you for you to vote, and so you don't have to go to town hall to vote or on the election day. And that's really important because that's actually something that a number of us have been pushing for years, is that the Massachusetts elections in general should really allow, you know, voting by mail. You know, there's some states where every single voter gets a ballot mailed to their homes to vote, as well as making more flexible the absentee ballot standard, so that, you know, basically for really any reason you could request an absentee ballot before the election and vote. So we made these reforms just during this unique time of 2020, but I am certainly pushing for changes for this to extend to the fall elections, because there's already questions, you know, about, you know, how are people going to vote in the fall. Well, I think, you know, we'll be past the pandemic, I hope. There'll still be the possible after effects and people's comfort level to vote, and really how to make it easier to vote. So this is sort of raising that discussion about, you know, voting by mail, changing absentee ballots, as well as allowing for same-day election registration to make sure that we limit and really eliminate any barriers to people voting. And this is just, in my mind, one example of how the pandemic has really raised bigger issues around everything from, you know, healthcare to, you know, small businesses to election reform as a result of this pandemic, and thinking about it from the public policy point of view and pushing for state and federal reforms.
Great, thank you. That's very helpful information. We appreciate it. Looks like we have time for one more question, and then we'll get to our closing poem. This question is from looks like it's from an MBTA commuter who's not working right now due to the governor's non-essential business closure. And is there any relief being provided to people who have parking passes at the reserve parking lots in Acton? That's a great question, and I'm glad you asked it, because we actually talked to the Board of Selectmen about that this morning in a meeting that we held. The board agreed to suspend for a period of March 24th through May 4th, which coincides with the governor's order regarding the business closures, suspend any fees for having a reserved parking spot for those weeks. So that what that allows us to do is allow people to keep their spot if they want to, and not have to pay the weekly amount. And if they want to continue after May 4th, they could start paying again at that point. So I think it's a nice gesture by the Board of Selectmen to help people that aren't able to work right now or use their space. So that's a great question, and thanks for asking. So thank you all for your participation. Thank you, Senator Eldridge. Thank you, Heather. Thank you, Sharon. Thank you, Evan. It's great to have you all here sharing information. We'd like to close out this Java with John with a poem from Sharon Mercurio. Sharon?
Not written by me, let me tell you.
Not written, okay.
So the poem this week is called Day 28. Forever changed is what they'll be. these children.
Sharon, hold on. Can you get closer to the mic or something?
Sorry. Okay. Is that better?
Yeah.
Okay. We'll start over. Day 28. Forever changed is what they'll be, these children of the pandemic. Whether shaped by panic or fear or the greater good, no child today escapes where the world once stood and now stands at a fragile start. The hope for all rests with an open heart, nurtured by together and not by distance dividing us apart.
Beautiful. Thank you. Be careful out there, everyone. Have a good day.